most important thing that I want to stress, that when you think to a cantilever as a solution, especially at the beginning, but I would recommend to do this always, you should think to the cantilever after you have figured out which is the needed force system for your active unit. Okay? So we are using a cantilever not because I've learned that the cantilever is 20 millimeters long, or should be done in beta titanium, or should have this shape, or should have this point of attachment, or no. I'm using this cantilever because it produces the force system that I need. Okay? This is a very important concept. You start from the force system that you need, and the force system that you need comes from what?
Final position that I want to
From the movement that you are planning. Okay, so first thing to the movement. From the movement you find out which is the needed force system. From the force system you start thinking to the cantilever. There is a condition where we are looking mostly for the moment. So to the active unit, the tooth we want to move or the teeth we want to move, we need a moment and basically no force. Or if you want a very large moment, where would you engage the cantilever?
I would engage the cantilever in the middle tooth, the canine, I guess.
So in the middle tooth, it's the active unit. So where?
Yes, in the active unit.
Okay. And where would you make the ligature?
To the incisor, so mesial to it, and
Okay, let's do it. Things simple. 1, 2, 3. Okay. So you engage it in tooth number 2 and ligate it in tooth
number 1.
Number 1. Okay. So, and which is the passive?
It's more to the incisal edge. So down.
Oh, down. Yeah. It's a nightmare. She's always right. Now it's a little step. You will see it. I'm engaging now the wire inside the tube. Sorry, it's out of focus, but I hope you see it. I'm going down. And I will curve the wire so that it's going to follow the curvature of the alveolar. So I'm taking the plier mesial to the molar, and I'm just doing a single bend like this. So all the bending is just mesial to the molar. Okay, so that's a V-band activation. It would produce, what is this used for? I don't know. Could be used for intruding the canine, intruding the anterior group, or uprighting and extruding the molar. We don't know it. It depends from many other factors. And anyway, this is the activation, and you see that the concavity of the activated cantilever looks towards the occlusal plane. You see that? This means that we are generating also an expansion force. You see very well here. I mean, the concavity looks up to the occlusal plane.
We will make an extension.
Very good. Who said that?
Dr. Ibrahim.
Okay, so you just make an apical extension. Of course, it's impossible to reach the CR, but if you get closer, you would reduce the amount of inclination. Okay?